We're going to take a deeper dive into a collection of symptoms known as Hard Flaccid Syndrome. This is when men may report symptoms of a semi-erect penis, difficulty getting or maintaining an erection, or complaints that their erection is less rigid. They also may report pain in the penis or perineum or pain with ejaculation. Some will report a feeling of muscle tension in their pelvic floor. Almost all of these folks will report some significant psychological distress when these symptoms have begun. Now, there are a few hypotheses about why these symptoms can develop. One hypothesis is there was some sort of trauma, particularly to the base of the penis. Now, this may have happened because of aggressive sexual activity or some sort of injury or activity that put the muscles of the pelvic floor at risk or compromised them. And so the thought is that by this trauma to the penis causes a tightening or contracting of the muscles of the pelvic floor, which then can affect the underlying venous structures, which the venous structures are important for normal erectile functioning. These muscles can contribute to pain with sexual functioning, as well as perineal or penile pain. So the biggest challenge with this is we just don't know. There is basically no literature in the medical literature about hard flaccid. It's not even an official diagnosis in medicine. It got its name from online forums where men were going to report these symptoms looking for answers. And this name, hard flaccid, was developed online. So not only is it not an official medical diagnosis, so most people aren't even aware that this exists, and there's no research to really help us understand this. The little bit of data, or not even data, the little bit of literature there is really talking about cases and just describing men's symptoms. So it's really come to fall upon a small group of urologists that have taken a special interest in treating male pelvic pain, as well as pelvic floor physical therapists to treat this population of men. So I probably began seeing patients or hearing about this collection of symptoms about 10 years ago. And over the last 10 years, I've treated more and more men that describe this collection of symptoms. And it's not that I think more and more men are developing these symptoms. I think there's just more awareness via internet sources. And so men have a name to attach to their collection of symptoms. So I've treated dozens of men with hard flaccid syndrome symptoms over the years, and a few things have really stood out to me that I'd like to share with you. So first is virtually all of these men that present with these symptoms or collection of symptoms have dysfunction in their superficial pelvic floor muscles. Now, these are the muscles that are part of the urogenital diaphragm. They are, in general, the ischiocavernosus, bulbospongiosus, and transverse perineum. Now, the primary function of these muscles is for sexual functioning and urinary functioning. So when they're dysfunctional, they can affect sexual functioning. And what I mean by dysfunctional is they can become too tight. Now, these muscles can become too tight for a variety of reasons, whether it's exercise-induced or consistently delaying orgasm, or it could be trauma to the muscles. So when these muscles become too tight, they can affect the ability for a man to get and maintain an erection, or can contribute to the semi-erect state. Also, when these muscles are tight, they are affecting the underlying nerves and vessels, particularly the pudendal nerve and the pudendal vessels. In the body, nerves, arteries, and veins all run together. So with the pudendal nerve, particularly the penile branch of the pudendal nerve, that branch and its vessels lie in between these muscles. So when these muscles are tight, it can compress both the nerve and the vessels, which are needed for normal erectile functioning. So that's the other component that I've noticed, in addition to these muscles of the urogenital diaphragm being dysfunctional, is the penile branch of the pudendal nerve being irritated or injured. And this is another common finding with men that present with these collection of symptoms consistent with hard flaccid syndrome. So this nerve can become compromised if the penis is overly lengthened or aggressively lengthened, and this can happen with aggressive masturbation or sex, or an intentional lengthening of the penis in an attempt to actually create a longer penis. So this is done manually, can be done with a pump or other devices, and commonly referred to as jelqing. So when this nerve gets irritated, can cause dysfunction in the surrounding muscles or the urogenital diaphragm, and those can all contribute to erectile dysfunction or the semi-erect penis or pain in this area. They also, when these muscles are tight, can affect the underlying vascular structures. In the body, nerves, arteries, and veins all travel together. And in the urogenital diaphragm, the pudendal nerve and the vein and the artery all travel in between these muscles. So when those muscles are tight, it can affect not only the nerve, but the other vessels, which we know we need, or a man needs, for normal erectile functioning. So I think when we're considering how to treat these folks that present with the symptoms consistent with hard flaccid syndrome, I think it's best to think of this as just male pelvic pain, and this is a variation of that male pelvic pain. Why these men develop these particular symptoms probably lies somewhere in their history, whether it's how and why they developed these symptoms, or maybe there was an injury or trauma previously to the pelvic floor structures that was unknown because it was asymptomatic before. So I think as pelvic floor physical therapists, or as physical therapists in general, it's always our job to listen to how the patient developed the symptoms, when they developed it, the other activities that may have affected the development of these symptoms, and then combine or make the connections between that history and what we find upon evaluation. So depending, and what I find typically with this patient population is dysfunction in those superficial muscles and sometimes the penile branch. So it's our job to put that together and then to create a treatment plan to address those findings and also educate our patients on safe and not so safe practices regarding the penis to limit further injury or irritation to those structures. And that, in combination with our manual therapy, often resolves those symptoms of hard flaccid syndrome. If you have any questions or have any comments regarding your experience with hard flaccid syndrome, drop us a question or drop us a line and we'll be sure to get back to you.